Liver disease is too common and has serious implications. I'm Dr. Sarah Bone, and today I will discuss some information regarding liver disease. I do want to give you a trigger warning. The topic today is graphic in nature, and if you have an aversion to blood or vomiting, this may not be the video for you to watch. This video that you're about to watch discusses liver disease openly and honestly. Hopefully you're in a non-threatening environment to gather this information. I do want to warn you about what is ahead though. Hepatic insufficiency is another term for liver disease. When a person has damage done to their liver, they can have many symptoms and they need a lot of assistance to manage them. There are several unique factors that make liver disease such an important topic. It's number 12 on the cause of death list from Vital Statistics. That's information that's gathered from death certificates. That's about 4% of all U.S. deaths are contributed to liver disease. Many causes of liver disease are treatable if they're caught early and addressed. Liver damage that is the result of alcohol can be curable, but again, it has to be caught and treated early. Alcohol-related liver damage is estimated by some to be as high as 65% of all liver disease. Acetaminophen can cause as much as 50% of acute liver injury, and it's a toxicity process that can occur if the over-the-counter medication acetaminophen manufacturing labels are not followed. If the insult to the liver is slow, the damage to the organ can largely be unrecognized in many people until late in the disease course. For some, it may be found too late for treatment interventions to allow for full return to health by the liver. You might not have ever considered it, but our liver is a vital organ. It has many far-reaching interactions with other organ systems. The liver is vital to the function of the body and our ability to maintain homeostasis. It works to break down nutrients for absorption, help with sugar management, it processes medications and chemicals, it works to detoxify our blood, and it makes proteins that are used all over the body in nearly every other organ system. Of the life-saving measures available that can supplement some other organ systems, there are none for the liver. The liver remains one of the organ systems that we really don't have an artificial alternative for. There are multiple different causes of liver disease, and this list is just a few. They could be inherited, such as hemochromatosis, Wilson's disease, alpha-1 antitrypsin deficiency, and inherited metabolic disorders. Immune abnormalities, such as autoimmune issues, primary biliary cholangitis, primary sclerosing cholangitis. There are so many more. Diabetes, infectious causes, hepatitis with, I would say, the capital H because it's an infection caused by a virus. So hepatitis is probably the most notorious, and we're not going to go down the rabbit hole of all the various kinds of inflammation caused by hepatitis. That's a wicked viral process that can attack your liver. There are some kinds of heart disease that can also injure your liver. Cancer can injure the liver, and many chemicals, including medications. Certain types of toxins that we take into our body in the form of medications, if they're not processed correctly, if they're taken in incorrect amounts, can cause damage to the liver. So some medications carry that risk with them, and even some herbal supplements can cause damage to the liver. There is another cause that is affecting an increasing number of people and becoming all too common. Obesity has been called an American epidemic, but it's actually affecting people from other countries as well. A liver injury process previously known as NASH, or non-alcoholic steatohepatitis, is now called metabolic dysfunction associated steatohepatitis. This liver disease is caused by excess fat cells that are in the liver, kind of between the liver cells themselves, and they result in damage being caused to the liver cells. It's most common in people with high lipid levels, high sugar levels that carry excess weight. The damage occurs over time by the fat cells injuring the liver cells that are around them, eventually resulting in some of the same scarring processes that are caused by other diseases that attack the liver. It is estimated by some that as much as 25% of American adults are at significant risk for fatty liver disease. Over 7% of people with fatty liver can progress to liver damage. The more risk factors a person has, the greater their risk. It can be severe and can become life-threatening. This type of liver cirrhosis is becoming a leading contributor to the need for liver transplant in females over the age of 65. Let's talk a bit about signs and symptoms. 40% of patients are typically asymptomatic. As with any illness, symptoms, severity, and treatment response can vary person to person. Signs and symptoms can be subtle or intermittent until the damage is advanced. For some patients, they have too little or no early warning signs that their liver has been insulted. Many symptoms don't occur until the disease is at a later stage. Some of these symptoms may include something called portal hypertension, and that's when the scarring in the liver has resulted in the liver becoming stiff, and it makes the liver divert blood through other veins of the body. Varicose veins possibly may occur visible on the abdomen around the navel, or hemorrhoidal tissue may occur, or varicose veins in the esophagus that can't be seen by just looking at a person. Any blood vessel that leads to or from the liver could back up with the stalled blood because of the stiffness of the liver, and that's portal hypertension. Abdominal pain and swelling. The enlarging liver can have associated fluid collect around it, and that can be called ascites. 80% of people will develop ascites if they have liver disease, and for some people, the recurring fluid collection is an ongoing problem that they have to have drained periodically. Itchy skin is also an issue for some people. The skin over time can become thin and can be noted to have easy bruising. In the late disease, people can get easy skin tearing that also bleeds very heavily. The urine can become dark, almost like iced tea, and that's because of the bilirubin that is spilling into the urine from the bloodstream instead of being collected in the colon. Pale or almost white colored stools or clay colored stools, there may be very little to no bilirubin that is going from the liver into the intestines, and that's what typically gives stool its normal brown color. Yellow eyes and yellow skin, again, as the bilirubin backs up into the bloodstream, it will deposit around the body and can discolor the skin and the eyes. The palms of some patients can become blotchy or red. They can have difficulty digesting certain fatty foods. They may develop episodes of confusion or hepatic encephalopathy. That can be due to an ammonia buildup in the blood, and they can also have a weakened immune system with increasing risk over time for spontaneous infections that can be quite serious. They can get an infection inside of their abdomen called peritonitis. They could get pneumonia or even a urinary tract infection because the liver again makes those proteins that are used throughout the body and also affects their immune system. Many of the symptoms are what I call cross disease symptoms. That means that they could look like they come from anything, such as nausea, vomiting, fatigue, decreased appetite, abdominal pain, weight changes, edema or swelling, heart failure. There can be muscle loss, but an increase in the abdominal size and girth, and disturbed sleep. Signs and symptoms that can indicate advanced disease may include things like in males, they can have decreased testosterone levels with testicular atrophy and enlarging breast tissue. Lung effects may occur, something called hepatopulmonary syndrome, where the blood actually backs up into the lungs themselves and makes it more difficult for a person to breathe. There can be trouble getting oxygen into your bloodstream because of the congestion of the blood in the lungs, and the lining between the oxygen and the blood picking it up can get thicker over time. Acute kidney failure can occur, something called hepatorenal syndrome, and this is a very worrisome condition. If this occurs, it can indicate that the end of life is very near. The narrowed blood vessels in the kidneys occur because of the severity of the liver damage, and kidney function can slow to shut down levels. Cardiomyopathy can occur, and that's where there's heart muscle damage. This process also occurs over a great deal of time due to the strain of the heart trying to push that blood through that scarred and stiff liver, resulting in something called congestive heart failure. Our liver is located in the right upper corner of our abdomen. It's protected a little bit by the right lower anterior ribs. The skin over the liver itself inside of your body is called the capsule, and if the liver is swollen because it's sick and it puts pressure on that capsule, it will result in a dull ache or pain sensation in that right upper corner of your abdomen. Sometimes it'll radiate to your shoulder, maybe to your flank or to your back area. The liver helps with processing food that is eaten by making and providing chemicals that are in the bile. The liver empties that bile into the upper part of the gut to break food down and process certain nutrients. It helps process some of the byproducts of the body, and it helps prepare wastes to be disposed of. Another important task is it makes some of the ingredients that are needed for blood clotting. The function of the liver is essentially important for good function of the other organ systems of your body. It's necessary for nearly everything. Our liver aids greatly in the maintenance of metabolic homeostasis. It processes dietary amino acids, carbohydrates, lipids, and vitamins. It metabolizes cholesterol, it processes toxins and eliminates them from the body, and it produces those clotting factors that I mentioned before, and it helps with glycogen preparation and storage, which is a tremendous energy source for your body. Injury to the liver parenchyma, the liver cells, is associated with an influx of acute or chronic inflammatory cells, and that's why we call it hepatitis. And I know that's kind of confusing because there's the big H hepatitis named after the virus, but there's also the little h hepatitis, which is the inflammation of the liver itself. Cirrhosis refers to the progressive diffuse fibrosing process. It's a nodular condition that disrupts the entire normal architecture of the liver. Remember that our liver has an incredible ability to get better and to regenerate, better than any other organ system. There are many tests that are used to evaluate our liver. Some of these tests are common and done very often. It's part of a routine physical. If these tests are abnormal and there are symptoms that indicate further testing is needed, more specialized tests will be checked. Some tests can be obtained from a blood sample, and other tests are more invasive. All tests, even if you think it's just a simple blood test, do have risks to consider, and it has to be balanced with the benefit of that information. A few key blood tests for your liver include the liver function tests, albumin, total protein, the INR, which is called International Normalized Ratio, platelet count, ammonia level, and some anemia and inflammation tests will also be needed. An advanced disease stage, the liver may be so badly damaged that some blood tests that come from the liver may actually begin to appear normal. When that occurs, there's no longer a lot of value in checking those tests because it may be falsely reassuring. And so we have to look at other indicators such as the INR and the platelet function. We discussed that a little bit in another video that we have on lab and imaging basics. To evaluate the liver requires some work. Depending on what's suspected, it will lead your clinician to the next battery of tests. If needed, they may order endoscopy and imaging. Imaging tests that are common include ultrasound, CAT scan, hepatobiliary scan, MRI, plus a few other tests that may be needed depending on the previous test results. For some people, a biopsy of the liver may be needed. This is not a test to be taken lightly. If your team is recommending a biopsy of the liver, they are really worried about you. When liver injury has been determined, we want to know what stage we're at. Scar formation or the process of fibrosis occurs over time. If the cell damage progresses to cell death, scar replaces the functioning liver cells. The severity of scar formation or the amount of fibrosis of the liver is indicative of the severity of damage to the liver. Some fibrosis may be reversible. Too many variables for me to really discuss here, but keep in mind the liver, again, more than any other organ, has a great ability to get better. There are 4 stages to describe the severity of liver insult. Injury with inflammation, and that's what we call hepatitis, but it doesn't necessarily mean the viral infection hepatitis. It's just the process of that inflammation. Fibrosis and scarring is the 2nd stage, and that's where the liver cells begin to be replaced by scar tissue. As that process advances, the liver can get stiff and it becomes difficult for your heart to push the blood through it. Your clinician can use a calculation and a clinical score that's based on your age, some liver function tests, platelet count, and this is really valuable for prediction of how much risk a person is at if they're over the age of 35. The scoring system isn't really valuable for people under the age of 35, but it can certainly imply how much likelihood a person has for developing fibrosis. Cirrhosis is the 3rd stage of damage, and this amount of insult is significant. This implies advanced disease stage. Typically at this stage, it's no longer completely reversible. This does not mean to stop trying by any means, because if you're contributing in any way to your own disease, it is imperative that you accept the assistance that you need. The other alternative is to help your family by getting your affairs in order and informing your healthcare surrogate of some reasonable choices. Sadly, though, for some people, their liver progression is out of their control. Thus, symptom management and palliation are most appropriate steps. End-stage liver disease or liver failure is the worst. It's the last stage of hepatic insufficiency. By the time that the liver injury has progressed to the final stage, it is causing some of the same symptoms and issues for everyone that has this process, no matter what the initial insult or cause was. It does not matter how a person got to the stage of end-stage liver disease, but at that stage, this is the last stage, and patients need support from their loved ones and help from a palliative team. The liver and thus the body are unlikely at this point to recover from the insult. When the liver decompensates, the remaining liver function is minimal, and there's no ignoring the symptoms that the patient has. At this point, having a team of people, each with a role to help with symptom management, is crucial to help the patient and their loved ones. There are a few terribly scary symptoms. One of them is bleeding. The development of varices indicates considerable fibrosis and stiffness of the liver has occurred. And just like cars backing up on the highway, blood vessels around the liver have blood cells backing up to them and creating varicose veins. And these veins can develop and become quite large. These varices could bleed, and it's a gruesome experience for everybody involved. The location of the varicose veins may be the abdominal wall around the navel, maybe around the hemorrhoid area, or possibly in the gut, particularly in the esophagus. If the bleeding occurs in the esophagus, this bleeding is typically slow and silent and painless, and it's very often unknown until the patient vomits or has a bowel movement. Remember, the patient has an impaired ability to clot, so there's typically a lot of blood that's lost when someone has esophageal varices and then begins to vomit. There are treatments to eliminate or significantly decrease these bleeding events, but they don't repair the fibrosing process that's caused the problem. Another worrisome symptom is confusion and the development of encephalopathy. The change of cognition is usually a result of a chemical imbalance, too much or too little of something. It could be due to an infection, dehydration, an electrolyte issue, a GI bleed, use of alcohol, rising amounts of ammonia in the blood, and as crazy as it seems, constipation can contribute to hepatic encephalopathy. Stage 0 of hepatic encephalopathy, there's minimal symptoms, maybe some memory issues, concentration changes, or attention issues. Stage 1 is mild. There's mood changes that are noted, sleep issues occur, there's decreased alertness and a lack of awareness. At stage 3, it's more severe, and there's disorientation, extreme sleepiness, even stupor can occur, and there's anxiety. Stage 4 is deep sleep or coma. This is another worrisome event that needs immediate medical attention. Each episode of hepatic encephalopathy is another insult to the person's brain, and there's a growing risk that full brain recovery may not be possible, and the next insult may be worse. During an acute episode of hepatic encephalopathy, there may be characteristic jerking movement of the limbs, and this is noted not in every patient, but in some patients. When they hold their arms outstretched and then their hands are bent upward at the wrist, their reflexes are increased. They could have Parkinsonian-like symptoms as well. There's an important difference between hepatic encephalopathy and acute alcohol withdrawal, but there are some similar features as well. Both are very serious and treated completely differently. An honest exchange of information is key to assist the medical team to initiate the correct treatment and not confuse the picture with many unnecessary tests that may take considerable time and could muddy the water when they're trying to treat someone as quickly as possible and treat them correctly. There are many other medical issues that need to be considered if a good history is not provided, and that will delay care. At end-stage liver disease, patients are evaluated for liver transplant many times. At this point, not typically before, patients will begin their transplant evaluation. When some of these symptoms have occurred and they're really worrisome, the time may be very short, and so the process needs to be started quickly. Less than 30% needing a liver transplant will actually receive a transplant. Often, transplants have good outcomes. 85% of people who receive a liver transplant are alive at 1 year, and 70% are alive at 5 years. The selection criteria for liver transplant they're very rigorous. There are a lot of stipulations. As expected, young patients do better. Older patients with many disease burdens may not fare as well. Thus, the candidacy is more difficult to obtain if there's other significant disease processes occurring. The average age for a person receiving liver transplant is 52. Less than 10% of the transplants performed on liver patients are over the age of 70 because of the risks that are involved with the procedure. Limiting the offense is the number one thing that can be done. Finding the cause and addressing it early is extremely important. For many, curative treatment may not be available, and ongoing care and medication is likely going to be needed. Your physician will have you see a nutritionist most likely. The nutritionist is going to spend time with you on an ongoing basis to review your diet and make suggestions. They may suggest things like limiting sugar, salt, alcohol, starchy or fatty foods. They may advise you something like having oatmeal with berries a few times a week, having whole grain breads, legumes such as peas, green beans, broad beans, as well as fish that's high in omega-3 and nuts. Basically, avoiding any prepared foods and eating from your garden. Dietary changes often include salt restriction and for some low protein, but typically not fluid restriction. At different points in the disease, fluids may be needed to address fluid and electrolyte imbalances. Starting and stopping medications to address fluid accumulation, use of antibiotics, diuretics, a medication called lactulose, beta blockers might be given, and for some patients, blood sugar medications are necessary. Removing fluid from the abdomen by a process of paracentesis can be done, but there are certainly side effects and some significant risks involved with this process. Many patients are followed by a palliative specialist team, an endocrinologist, a hepatologist, along with their PCP. It's a coordinated effort to care for these patients. The tough topic of prognosis and trajectory should not be ignored. Patients and families have a right to know what's ahead. Life expectancy in liver disease could be as short as just a few months if the disease is advanced and it does not respond to treatment. Yet if the liver disease is found early and responds well to treatment, with good self-care and good health care, life expectancy can be stretched to many years. For patients that do have a limited lifespan remaining, they too can fight against that prognosis by getting help as early as they qualify. Receiving symptom management from a palliative care team can enhance the time and prove the book wrong. Having a team that comes to your home and managing every aspect of your disease can be a tremendous difference maker. Understanding the disease and having frequent assistance from the team improves your quality of life as well as the function. Quality of life that the team can help, they will help not just the patient, but also the entire family. They work with the person to reduce their disease burden and increase the amount of time between flare-ups. The palliative team can help manage those symptoms and provide the care that is going to be necessary to have an improved life. The team is going to evaluate the patient's vitals, the swelling of their legs and abdomen, help manage their bowels, monitor their weight, effects of medications, and provide the support needed by the loved ones as well as the patient themselves. The team is going to educate people as far as how to manage those symptoms, what to track, and how to watch for those early warning signs that decompensation is near. They're going to also address who to call, when to call, and how to manage those symptoms at home. The person's support system of friends and loved ones also needs their own support, and they can receive that from the palliative team. The team is going to assist with monitoring those medications that are required to be adjusted to help manage that disease state. Most teams will coordinate with the patient's multiple specialists and PCP. Many patients want to maintain all of those relationships. The palliative team develops a relationship over time to help the person and their loved ones prepare if treatment is not successful and if decline is occurring. They can help the person identify what is important to them and what brings them joy in their day, and when the phrase quality of life is used, what that means to them. Discussing these sensitive subjects takes time and deserves time, compassion, and empathy. Members of the palliative team are well educated on these sensitive conversations. Loved ones often ask how they can best help out, above all by providing unbiased love and support. Allow your loved one to complain and remind them that your ability to love them does not give you the ability to make their liver better. You support them as best you can, but the healthcare responsibility needs to lie with the professionals. Help them go to their visits, provide them with encouragement. If they need medications picked up or delivered, you can certainly assist with that. Ensure that your own physical and mental health needs are being met, and you must be well or you won't be able to assist them. If you need a break for an hour or a day or longer, talk to your palliative team and see if they can assist with helping you find respite. Being aware of the disease stage is helpful to everyone. Sometimes patients and their loved one can get lost in the forest and they may not feel like they can see the trees. I've heard many families say it happens so fast. Sometimes it does, but more often they've been so busy and preoccupied with daily care, day-to-day issues that are occurring, that they've really not had time for adequate preparation. Again, this is where the palliative team can really assist, as they're trained on assessing that stage and trajectory and can gently provide the assistance that's needed to guide a patient and their loved ones through the difficult times that may lie ahead. In summary, liver disease is serious and needs to be addressed as early as it's found. It's a bit sneaky, and it can cause some significant damage to the liver before it's really recognized because of its indolent behavior. Supporting your loved one can be done in many ways, and it's best when a team is involved. There are many facets of the disease, and taking better care of the person and their liver can assist with having a better quality of life and a longer life expectancy. The improved quality of life is so important, as for many people and their families, they find that having more time alive is not enough. They want better time living the life that they have. A palliative team will work with the many specialists that the person needs. They will work to limit the progression of the liver injury and decrease the symptoms that they're suffering from. They will intervene often, providing education to the patient and family, evaluating medications, and making changes as needed, as well as kindly and proactively helping everyone prepare for the future. The goal is to improve the patient's care and function. Because of the enormous burden and frightening nature of this disease process, having assistance from an integrated team will decrease the difficulties of the patient as well as their loved ones. Thank you for being here today. I appreciate that you've been sharing the information with your friends and with your family, and so many of you have subscribed. I hope that this provides helpful information to you. If you have a specific question or comment, please leave it in the comment box below. Check out some of the other videos, and if you have a specific topic you'd like to hear about, leave a request. And for those of you that have watched to this point, yes, I broke my hand. More about that later. Thank you very much. I appreciate your time.